This is my second time for the ovarian cancer forum presentation. So probably I'm doing something right to be invited again.
Yeah.
I'll try my best. Okay, so I was asked to talk about management or treatment-related side effects for ovarian cancer. 20 minutes not enough. So I will try to summarize a few things which I think will be useful from your perspective. And I've chosen two difficult topics from a medical or health professional point of view to help people. So just as a brief introduction, symptoms of the disease and side effects from the treatment. They can go hand in hand in people with ovarian cancer and any other malignancy which is advanced. For early stage disease, often there may not be many symptoms from the cancer itself, but in advanced cancers, symptoms from the cancer itself is and can be debilitating. And on top of that, when you give treatment, and as you know, ovarian cancer women have surgery. Something interesting happening.
That's it. Right.
Okay.
This should be.
Anyway, I'll use that. So surgery, chemotherapy, and increasingly targeted agents are also coming up. You might have heard of LinPath or olaparib, which are called as PARP inhibitors. And last 3-4 years, people have been treated with Avastin or bevacizumab. These are not chemotherapy agents, and they do have different set of side effects. And surgery sometimes could happen multiple times here, surgery here, sometimes surgery at the time of recurrence. And the type of chemotherapy used also varies, whether it's newly diagnosed or at the time of recurrence, the first line, second line, third line settings. So various number of treatments are provided for women with ovarian cancer. And it's just to show the ways we can identify people when they present with high risk status like BRCA carriers. They may not have any symptoms initially, but when cancer comes up, there will be symptoms, as you know, of bloating and the likes. And when people undergo chemotherapy in the preoperative setting, before surgery is called as neoadjuvant, or adjuvant meaning after surgery. So at the moment, the proportion of women undergoing chemotherapy before surgery is slowly and steadily increasing. 5-7 years ago, surgery was given upfront and then chemotherapy after. A small proportion of women used to have preoperative chemotherapy. Now, in my experience, it's 30-70. And some situation it could be 50-50 in terms of, I'm talking about experience in cancer centers. 50% of women getting pre-surgical chemotherapy to try and downstage or decrease the size to make it easier for surgery. All right. This is to show a trajectory of what's happening when the cancer is diagnosed. And these are all some of the terminologies we use: primary prevention, secondary prevention, tertiary prevention, quaternary prevention, depending on before the cancer diagnosis, after cancer diagnosis, after treatment, and survivorship issues, and so on and so forth. Symptoms and signs and side effects can manifest in every stage of the trajectory of the cancer. And these things are applicable for any type of illnesses. Here we're specifically focusing on ovarian cancer because of the way it is organized after all. Okay, and just another piece of information, when people recur after the primary treatment, depending on how soon it reoccurs, 3 months, 6 months, 12 months, they could be called as refractory cancer or resistant cancer or partially sensitive cancers. And here the sensitivity depends on one of the chemotherapy agents called carboplatin. So we put the phrase as, go back, platinum resistant refractory sensitive cancers. And symptoms differ depending on how soon the cancer grows back as well. Alright, this is taken up from the Ovarian Cancer Australia webpage. We all know most of the symptoms before diagnosis, but some of them are really critical to understand. Anyone with unexplained fatigue, weight loss or weight gain sometimes, bowel habit changes, and frequency of urination could also be a manifestation of ovarian cancers. And these are all symptoms, right? And often they are so common, like bloating, we ignore them, may not recognize as ovarian cancer symptom. I see some familiar faces in the audience. I assume you might have experience with ovarian cancer already, either yourself or in the family members. So if you reflect on before the diagnosis, you might have felt some kind of bloating and fullness as a common symptom. And the same kind of symptoms would appear at the time of reoccurrence as well. But it's not a panic situation. I'll explain later when to really worry about when the symptoms appear. Another important thing which gets forgotten about is family history. And you'll hear from Kathy around the family history of illnesses which could appear with the symptoms of suspicion for ovarian cancers. Symptoms during treatment. This is again taken from Ovarian Cancer Social webpage. It is a long list of symptoms. I could spend easily an hour, if not longer, talking about each of the symptoms or side effects of the treatment. What is not mentioned here is surgical complications. The pain, scar, bleeding from surgery, deep vein thrombosis like clots appearing in the legs and sometimes even to the lungs, call it pulmonary embolism. These are all known complications of surgery which are not necessarily listed in this page, but I would like you to remember those as well. Moving on, some symptoms post-treatment, and this is where we move on to the real survivorship issues. And we have two excellent psychologists going to talk, Amanda and Charlotte. I feel inadequately prepared to talk about the emotional changes. I'm going to leave it to them, but something I observe in people is often loss of independence and feeling the need to depend on other people for simple things which could happen post-surgery. It's easier to accept help from others when we have a big scar in the tummy, but not after chemotherapy. Why is that? I commonly hear post-chemo, first week, second week, I can't do this, I can't do that. But post-surgery, accept the scenario that I'm going to be bedridden, I'm not able to do certain things, I'm happy to get help from others, but not after chemo. So chemo is invisible, goes inside, and you don't see a scar. So I keep giving this example of imagine people are having surgery every 3 weeks. You don't just see the scar, but the effect on the harm it does to the body is exactly the same. So one way of thinking differently to understand the debilitating effects some people could face. And the late side effects of treatment, that's what I'm going to focus on for the rest of the talk. And the top two here, fatigue and brain fog, which is people colloquially call as chemo brain. I'm not going to talk about the rest of the stuff, we won't have time. Okay. Post-surgery chemotherapy, there's a new normal. And is this new normal really normal? Or still questioning why am I like this? And how soon can I adapt to the changes? Including the difficulties of recovery from surgery, chemotherapy, nerve damage and whatnot. And that's where keeping a journal of all the symptoms people develop. And this part of the slide shows how to take notes in terms of symptoms. It clearly links with the fear of recurrence. So post-chemotherapy, I'm coughing now, oh, is it cancer? I'm having backache now, oh, is it cancer related? So even for minor symptoms, you're going to panic. How do we understand that we are humans, we are going to have problems like backache after I've done some work in the garden, or I'm going to get cold like anyone else, and flu, I'm going to cough, I'm going to have bad days like tiredness for a couple of days if I've done extreme level of physical activity. These are all usual manifestations, but if they linger on for a few weeks or longer, and if we can't put a finger into why I'm getting the side effects, that's when starting to ask for medical assessment will be a good time rather than one or two bad days of symptoms appearing. So I would suggest 2 to 4 weeks is a good time, but you can't be too relaxed either, waiting for the pain to go away because I lifted something in the backyard and hurt my back. But those kind of symptoms should improve in the matter of days to weeks. If they persist, that's the time to seek medical attention. Okay? It's a fine balance, not to be too paranoid, not to be too relaxed. And if you don't know, ask. I feel I'm concerned about these symptoms. How can you help me? So it's not the answer to this is not scans all the time. It may be a simple examination trying to figure out, it could be a bursa which is inflamed in the pelvis, the right hip, left hip. We have to do a different kind of set of investigation to confirm that. All right, fatigue. So, who's in the room hasn't had fatigue in their life? So all of us have had fatigue, right? But cancer-related fatigue is different. So the feeling is, as a whole body, extremely tired. And it can be caused by the cancer, it could be caused by the treatment itself. And these are all some of the manifestations of cancer-related fatigue. When I say cancer-related fatigue, it also includes treatment-related fatigue. So this fatigue is different to the normal fatigue we feel. I've done 10K walk, my legs are going to feel weak, I'm going to rest for the day, rest of the day. But I'm going to feel better next day. That's not the case with cancer fatigue. And these are all differences between cancer fatigue and normal fatigue. Sleep doesn't relieve the symptoms. Even simple day-to-day activities, normal things for us may feel harder. It affects everything, the way we think, our thoughts, behavior, the way our body feels even to a simple touch. You don't know why it happens. Why the cancer causes such level of fatigue, why chemotherapy causes such level of fatigue. We can't identify a mechanism behind it. And it's not proportionate to the amount of work we have done. It may be 10 minutes of action, physical activity I mean, and 4 hours gone. So that could be the difference in the way cancer fatigue from normal fatigue. And they can come and go as they please. There is no fixed pattern to it. So these are all some of the ways cancer-related fatigue could manifest. And some interesting characteristics on the right side. The way we eat also changes. Sleep may be affected. So is it because I'm sleeping poorly, cancer fatigue comes up, or is it because of the fatigue I'm sleeping poorly? Chicken or the egg? And it's not just the cancer causing fatigue, or chemotherapy causing fatigue, or the targeted drugs causing fatigue, but any of this. So, and that's why it becomes really difficult to pinpoint a single reason why people feel so tired. What can we do about it? This is an interesting website. Probably even Ovarian Cancer Forum could look at, or Cancer Council can look at. It's from Canadian government, Princess Margaret Hospital. Some interesting tips for managing fatigue. They call 7 steps. Track the fatigue. And what are the triggers? Is it because I had a glass of wine last night, I'm feeling tired? Or is it because I didn't sleep for the whole day, I'm feeling tired for the rest of the day, the rest of the night, or next day even? Can we include some activities, like physical activities and exercise? And this is important. Do things you enjoy. It could be just in the moment, watching a movie, or reading a book. It could be a simple YouTube video, or watching your grandchild walking around. Getting a new hobby. When you're feeling tired, it may feel as if, what, I'm going to learn something new. It's not going to be possible to learn something new. But that gives the drive as well, that motivation, I'm going to do something different. Eating well is important. And the remaining 3 strategies are how to reduce stress. I've put in some things there. It may work for some people, like being mindful, being active, breathing. Massage may help for some. Even prayer for some people. Some prefer meditation. Some people just like to talk to family members and friends, or Cancer Council helpline. And now I'm hearing the Ovarian Cancer Forum has got some consumer support as well. So are you going to talk about it?
Case management.
So case management, so you could seek help to talk. Sleep. And these are all some strategies to get good sleep. No iPad on the bed, no TV, no caffeine, try and avoid alcohol closer to the sleep time, no large meals, and more important things at the bottom, learning to deal with the thoughts and emotions. When we are trying to go to sleep on our own, not much noise, but our mind goes crazy thinking about various things. And saving energy. I got a big day tomorrow, graduation for my grandchild, or my son or daughter. I'm going to do little today so that I could preserve some energy. Prioritizing. If you see dirt on the table, it's okay. Alright? So if you see laundry not done, that's okay. When you're feeling better, stronger, next couple of days, you could do it. So prioritizing. And more importantly, being patient to ourselves matters too. Alright, that's fatigue. And some tips on being active. Any activity may manifest or respond differently to each one of us. An activity which you really enjoyed may not be enjoyable anymore after chemo or cancer treatment. So I need to discover a new activity. I like walking, probably now I like sleeping. That kind of extremes could happen as well. And look for patterns and what causes tiredness, and can we minimize it, or can we learn to adapt better when I'm trying to do that activity so that I'm not so exhausted next day. In my practice, I see quite a few patients come back and tell me, third week of chemo, I feel fantastic. I did all the gardening, weeds done, but next 2 days, buggered. Right off. So how do you plan the days and the weeks? And I've had other people telling me, I plan all my social activities in the third week when I'm feeling good. First 2 weeks, I don't book anything in. So planning and prioritizing. Brain fog. This is based on some of the work Amanda and I have done in other cancers. So Amanda may be better to talk about exactly what the psychological aspect of it. But these are all some of the statements made by people. This is an old study, but some of them may remind us what we feel after chemotherapy and surgery even. Although brain fog is considered to be chemotherapy fog, increasingly the evidence is showing it's like the cancer-related fatigue, it's cancer fog. Okay. So even being diagnosed with cancer can create some changes in the brain which feels this may some of the symptoms here. So some simple to extreme examples. I used to be stark smart, my IQ has gone down. Yes. Alright, these are some of the names. Now increasingly, as I said, is brain fog or cancer fog. Okay, 2 minutes. Alright, so these are all some of the areas of the brain which can be affected in terms of functioning. I'm going to skip this and move on to, although just as a tidbit, breast cancer women are the first ones to complain about brain fog post-chemotherapy. And now we know that it happens across other cancer types as well. And this is to show structural changes in the brain. Previously, we believed that chemotherapy was a myth, chemotherapy-induced brain changes was a myth. But animal studies have clearly shown that there are structural changes in the brain. For example, this is normal brain. You could see lots of connection, and this brain doesn't have much connection. So the connections, brain processes are being altered by the chemo. Alright, symptoms, it could be as simple as losing attention, short-term focus, short-term memory all affected, or it could be as severe as I can't even judge my distance when I'm parking my car. So these are the worst extremes. I'm going to skip on that. And these are some ways how brain changes, functioning changes are affected. This is called a trail test, where people are asked to connect 1 to next alphabet and 2B, 3C, like this, you draw a line all along. And some people with severe chemo fog may not be able to join all the dots. And another interesting thing is called a Stroop test. just as an example, so the color is red, right? Red, blue, green, yellow. So you read every row, and you read the color again, red, blue, green, yellow, but then it becomes tricky. Now you have to state the color and not read the word. So green, blue, red, blue. Alright. So these are the ways you can finally test individual domains of our brain function. What can we do about it? Very little we can do based on evidence. I'm not going to talk about the psychological or pharmacological intervention because none of them are validated or proven to be useful. But what is going to be useful are some of the things coming up here. Yes. I'm going to simplify it here. So keep a diary. Be mindful of what you're planning to do. Try and be organized. I know everyone in the room is a superwoman and superman, but we can't multitask. Okay? Multitasking is a myth. Especially when you have chemo or surgery, multitasking is going to be out of the window. So do one thing at a time, and that's where the mindfulness comes in. And another important thing here is this part here. If you can't remember, don't criticize yourself. Being patient to ourselves becomes really, really important. It's okay to forget. That's all right. Okay. So when the brain is so stressed from chemo and surgery and anesthetic people have and painkillers we take, it's going to be so jumbled up. And I already showed you the structural changes happening in the brain. So all the processes and connections with joint neuron is not going to cope with the stimulation which comes from listening to music and trying to talk to people. How is it possible? Even in normal sense, when you don't have other stresses in life, it's going to be impossible. Right. So we got an auditory stimulation, and then we have to make our brain work harder to talk. So I'm going to finish with the last bit. Nothing magic, simple common sense strategies to deal with most of the side effects I've discussed. Being active, eating well, resting, and try and challenge ourselves to learn something new. Having a goal, it could be short-term goal, it could be long-term goal. I'm going to cook for Christmas, or I'm going to walk 5Ks, or I'm going to do City to Bay next year. I'm going to train towards it. Could be as simple as I'm going to walk 5Ks this weekend, or 1K this weekend. And importantly, connecting with others. And this is one example of a forum where like-minded people are in the room. So it doesn't have to be people going through similar experiences. Instead of shutting ourselves in the room on our own, opening up helps. Let's stop there.